And over the past decade or more, there's been interest in the use of radiation therapy to stimulate the immune system. I think radiation has tremendous potential in that regard. Radiation increases antigen presentation. It increases dendritic cell activity through the recognition of the damage-associated molecular pattern with release of ATP, calreticulin, high mobility group proteins, and so forth and so on. And this results in this so-called abscopal effect, whereby if you radiate a lung cancer or a metastatic deposit in the left lung, you can see regression in the right lung or in the liver. So it's potentiating immune blockade, immune checkpoint blockade. And I think there's a lot of unknowns mechanistically and practically in terms of how you integrate radiation with immune checkpoint blockade. Which comes first? Do you give the radiation first? Do you give the immunotherapy first? What dose of radiation is optimal? Recently, there have been several molecular pathways that have been identified, including the C-gas sting pathway, where damaged DNA goes into the cytosol and turns on an interferon response that leads to dendritic cell stimulation. If you give too high of a dose or too low of a dose, you may not get that response. So I think the real future is understanding the many potential permutations and pathways that are involved in potentiating the immune response, whether radiation can make a contribution to basically auto-vaccination, releasing the individual tumor antigens of a patient's given tumor to produce a systemic effect.